Hello, my name is Shakaya and I will be beginning today by providing an overview of the preventable condition type 2 diabetes mellitus. Type 2 diabetes is a progressive disease in which the body becomes resistant to the effects of insulin and or may no longer be able to produce enough insulin in the pancreas to regulate the body's blood glucose levels. Type 2 diabetes is referred to as progressive due to the continuous destruction of insulin-producing cells in the pancreas over time. This disease usually develops over an extended period of time, up to a few years, and is most common in middle-aged adults. The cause of type 2 diabetes may often be accounted to a genetic predisposition. However, lifestyle factors play a major role in the development of this disease. The risk of type 2 diabetes is greatly increased in people who are overweight or obese, have high blood pressure, do not partake in regular physical activity, have a poor diet, and engage in smoking. Therefore, type 2 diabetes is largely preventable if one controls these modifiable factors. Prior to the diagnosis of type 2 diabetes, a person may be asymptomatic, or if symptoms are present, they may be dismissed as an alternative cause, such as the normal aging process. However, these symptoms can include excessive thirst, frequent urination or nocturia, lethargy, increased hunger and weight, mood swings, headaches, leg cramps, and will often cause a slow healing process for cuts and wounds. Therefore, it is important to pay particular attention to the person overall if considering type 2 diabetes. Although there is no cure for type 2 diabetes, it can be managed with the improvement in one's lifestyle factors. This includes regular exercise to maintain or reduce weight and improve overall health, as well as eating a healthy, balanced diet. In addition to these lifestyle changes, oral medication and insulin may also be needed to control one's blood glucose levels. However, it has been proven that through diet changes and weight loss, it is possible for some to reverse type 2 diabetes. Using the term reverse does not mean the condition is cured. However, a normal blood sugar level is achieved and held without the use of medication. Therefore, one can live their normal life without any disruption from the disease. Throughout the progression of this disease, it is important to monitor one's management and symptoms, as early recognition of deterioration can prevent future complications. Overall, type 2 diabetes has the ability to be managed effectively with the proper education and compliance.
Thank you, Shakaya, for that thorough insight into what type 2 diabetes is. Now that we know what the disease is and does, we need to further investigate the incidence of occurrence of type 2 diabetes within Australia, particularly within the Indigenous population. Chronic disease among Indigenous Australians accounts for 64% of the total burden of disease, with type 2 diabetes being the second leading cause, with 11% of Indigenous adults being diagnosed with the condition in 2017. This is 3 times the rate of non-Indigenous Australians. It is also one of the leading causes of mortality in Indigenous Australians, with 6.4% of deaths occurring due to diabetes between 2011 and 2015, compared to only 2.4% of their non-Indigenous counterparts. Some of this gap is due to limited access to adequate healthcare education and healthcare services relative to geographical location, with 1 in 5 or 19% of Aboriginal and Torres Strait Islander peoples living in either remote or very remote areas. This rate is substantially higher than that of non-Indigenous Australians, with 1.5% of those living in remote communities. Living in such remote areas limits access to adequate healthcare resources to treat chronic diseases like type 2 diabetes, even delaying initial diagnoses and causing the fast progression of diabetes that medical interventions may have prevented had adequate access to education sources and healthcare services had been provided in these remote communities. As you can see, there is a large gap between Indigenous and non-Indigenous Australians concerning this healthcare issue. The most damning cause for this can be explained by the social determinants for health, with 39% of the gap in healthcare outcomes between Indigenous and non-Indigenous Australians being caused by the social determinants for health, as found by research done by the Australian Institute of Health and Welfare. The social determinants for health can be described as the factors that affect a person's healthcare outcomes outside of the healthcare system. I will now hand you over to John, who will discuss these determinants for health and how they relate to further risks for Aboriginal and Torres Strait Islander peoples living with type 2 diabetes.
Thanks for that, Jala. Indigenous Australians are exposed to several risk factors associated with the development of type 2 diabetes. These include historical, social and cultural determinants not usually seen among the wider Australian population, and continue to contribute to earlier onset and higher incidence of type 2 diabetes in Indigenous communities. Indigenous Australians are more likely to have behavioural and biomedical risk factors which predispose them to type 2 diabetes development, including tobacco smoking, poor nutritional intake, low levels of physical activity, hypertension, dyslipidemia and obesity. The development of type 2 diabetes can also be influenced by historical, cultural, social and economic factors along with government health services and policies. The health disparities experienced by Indigenous Australians may be historical in origin, but continues to be perpetuated by Western contemporary society. The prevalence of type 2 diabetes in Indigenous communities didn't become apparent until well into the 20th century, with the first case of diabetes in an Indigenous Australian recorded in 1923. Prior to this, Indigenous Australians were known to be lean, fit and free from metabolic conditions common in European populations. This is reflective of their hunter-gatherer lifestyle, which was maintained up until the late 18th century. Studies investigating type 2 diabetes in Indigenous Australians start as early as the 1960s and highlight significant links between the adoption of the Western lifestyle and the levels of type 2 diabetes. Many Indigenous Australians live in extremely remote areas, which impacts on the accessibility and quality of healthcare services as well as health education. Employment opportunities are sparse and often unattainable, leading to a reliance on low-income welfare payments. Unemployment gives rise to high-risk behaviours including low physical activity, smoking, alcohol and drug abuse. The availability of fresh foods is often restricted and unaffordable due to the logistical practicality and lack of storage facilities. These factors all lead to misinformation, poor diet and lifestyle choices, which contribute greatly to the development of type 2 diabetes. I will now hand off to Lani, who will discuss strategies which can be put in place to prevent to reduce I will now hand off to Lani, who will discuss strategies which can help prevent and reduce type 2 diabetes in the Indigenous community.
Team for the information provided so far. To continue on from what has been said, we need to talk about the different strategies to reduce or prevent the development of type 2 diabetes. I came across a few strategies for Indigenous Australians in relation to type 2 diabetes, and the first one I'm going to speak about is called Keep Culture Life and Family Strong, Know Early About Diabetes, which was developed by Healthy Living Northern Territory in conjunction with Diabetes Australia. It is a package that helps Indigenous Australians with healthy living practices to reduce the risk factors associated with type 2 diabetes and reduce the severity of the disease by recognising it early. The package includes information in regards to nutritional information, management, symptoms, medications, how to cope, and how to keep the family involved. This strategy is targeted more for people with type 2 diabetes but want better outcomes and less risks. Another program that was commenced in 2014 is called the Indigenous Australians Health Program, which provides type 2 diabetes prevention and management through primary healthcare and initiatives. This includes a nationwide tobacco reduction, healthy lifestyle promotion activities, a care coordination and outreach workforce based in Medicare locals and Aboriginal community-controlled health organisations, and GP specialist and allied health outreach programs which are serving in urban, rural and remote communities. The New South Wales Diabetes Prevention Framework is another strategy in place to help in the reduction of developing type 2 diabetes for everyone, including Indigenous Australians. It brings together evidence-based practice to develop a range of strategies in the prevention of type 2 diabetes or in the reduction of the complications associated with the disease. The focus of this framework is to educate people and have them realise that in many circumstances it is avoidable due to the modifiable risk factors that can prevent the onset of type 2 diabetes, especially in high-risk populations such as the Indigenous Australians. The framework develops many health approaches such as the Get Healthy Information, which is a telephone service supporting people in making improvements to their health, the screening and risk stratification for the disease, and the clinical management of people with existing type 2 diabetes. Lastly, the Australian National Diabetes Strategy 2016 to 2020 has recognised that all Indigenous people of Australia need strategies to help with type 2 diabetes prevention and management due to the high prevalence of the diseases in their society. Overall, the strategy is in place to better coordinate health resources across all levels of government and to focus on the resources that are needed most in relation to the disease. It aims to prioritise Australia's response to diabetes and to identify how to approach the impacts it makes and leaves in the communities. In particular, one section of the strategy is dedicated to the Indigenous Australians with the aim to prevent type 2 diabetes and improve management to those who are already diagnosed. Access to support, education and services are of uppermost importance so that the benefits can be seen. It has actions in place with a goal in mind, with some of the actions including culturally relevant awareness programs, development and implementation of community-wide interventions to increase the availability, affordability and consumption of fresh foods over all the packaged and processed foods, encouragement of primary healthcare services to better identify and manage type 2 diabetes, and the necessary specialist support, just to name a few. With all these different programs and strategies in place, we should hopefully start to see a decrease in type 2 diabetes within the Indigenous Australian people.
Thanks for that, Lani. Great information outlined there to help our newly recruited rural and remote health professionals. Wellbeing for Aboriginal and Torres Strait Islander patients incorporates the broader issues of social justice, equity and rights. Culture can influence Aboriginal and Torres Strait Islander people's decisions about when and why they seek health services. Their acceptance to treatment, the likelihood of the adherence to that treatment, and the likely success to prevention of health promotion strategies. Registered nurses are labelled as the most trusted profession in the world due to their therapeutic communication and rapport with their patients. Time must be taken out to build rapport and engage with Aboriginal and Torres Strait Islander patients, as this creates an effective relationship built on trust, openness and inclusivity. This relationship can only be built on the foundations of mutual respect without judgment. How do you show Indigenous people that they are welcome in your practice to receive your health services? Do you have Indigenous flags displayed? Indigenous artwork on the walls, or a welcome to country sign on the wall? All of these things may seem minor, but they are statements to show Indigenous people that we acknowledge and respect them and that they are welcome to access our health services. When integrating Indigenous people into healthcare practice, we must acknowledge and incorporate their values and beliefs into their cares. Commitment to family is a strong value in Aboriginal and Torres Strait Islander culture, and they rely on strong family ties as a way of passing on their story from one generation to the next. It is...
Just edit it.
I'll have to. Oh, lucky. It is important that we as health... I'm going to stop it. It is important that we as health professionals acknowledge and accommodate this. Allow your patient to bring their entire family to the consult. Bring in extra chairs into the hospital room for their family members. Offer tea and coffee to show that they are all welcome. This is an opportunity to build rapport with not only your patient, but their entire family, and that can result in them feeling welcome to come back and access your services again in the future. Through cultural acceptance, rapport and respect, we can engage, educate and empower Aboriginal and Torres Strait Islander patients to be in control of their own health. This is a vital aspect of preventing and managing prevalent conditions among Aboriginal and Torres Strait Islander people.
The Nursing and Midwifery Board of Australia further illustrates the importance of cultural safety, therapeutic communication, respect and trust in Standard 2 of the Professional Standards for Practice, which engages in therapeutic and professional relationships. As new rural and remote health professionals, it is so important that you understand just how much of an impact you can have on the prevention and reduction of type 2 diabetes for Indigenous communities. We hope that our presentation has assisted you in developing the knowledge and skills required to successfully close the gap for Indigenous communities. Thank you.